The day you are told you have cancer is the day you begin a very important relationship with your doctor. And with that relationship, you're going to bring in all your fears, anxieties, and frustrations. And although deep down inside, you and every other patient pray that that doctor is going to be perfect just for you, understand that he or she will never be perfect because they're human too. And the fact is, there are curt to the point doctors and warm, empathetic doctors too. However, just like we sift and sort our friends so we can focus on the ones that will always be there for us and place our best interests at heart, there are ways to make sure that you choose a doctor who meets most of the criteria that you consider important. And to help you pinpoint what those things might be for you, let's take a look at what two women, as well as the husband of a breast cancer patient, listed as their criteria in choosing an oncologist who would dig in and get in the corner with them and help them fight their disease. For Nell, she was looking for a doctor she could really communicate with, and that meant to her someone she could express her fears to without feeling guilty or without being judged as to not handling things very well. And it also meant a doctor that would not feel threatened with her questions when she suggested things. Nell did a lot of research, and she felt particularly lucky because her doctor was open to changing his mind about ways of approaching her treatment when she'd introduce new ways of doing things or she'd introduce something that she found. And to this doctor's credit, he openly admits that he has rethought some of his approaches because of patients just like her. Nell says, it's great if you can find a doctor who really shows they care enough to be open like that. Now, for Sharon, the most important factor was that she find a doctor who was at what she called the top of the game. It didn't matter to her if they seemed less personal, rushed, or harried, because she said, I can always find a way to get them to slow down and give me what I need so I can make a good decision. She said, all I have to do is acknowledge that, yeah, okay, you guys got a heavy patient load, I realize that, but this is really important to me, and I need a little extra time today. So these are some of the ways that she'd get around that. And she says, I've watched some of my friends let themselves be intimidated by doctors, and this is a mistake, because very often they're mistaking what feels like a clinical manner as maybe that they didn't care. And she says, well, a lot of times they just don't want to waste time and they want to stay focused because they want to be able to give the very best attention they can to that person. Now, Dave, he actually participated with his wife not only in the choosing of the doctor, but in her treatment care as well. She was diagnosed at age 66, and they both wanted a doctor that would give her a vote, one that would not make assumptions just because she was 66 years old, that they could offer less options or maybe not give her the max treatment simply because she'd lived a good portion of her life already. That to instead realize that it was her right to decide what treatment she wanted to avail herself of. Because after all, they thought, who has the right to decide whether the next 10 years of her life are not as valuable to her and perhaps to society as the next 10 years of someone who's 35 or 45 years old? It's a very good point for people who are diagnosed older, to make sure that that thought is not back of their doctor's mind. All these people have illustrated good points, some of which you might want to incorporate in finding a doctor that is perfect for you, that you can feel comfortable with and confident in their abilities to do what's right for you. However, be aware that despite the progress in patient advocacy, there are still oncologists around who really don't foster that partnership approach with their patients in decision making and other aspects, and who might be less receptive to your questions or your research findings. So, if you got a doctor that you're confident in their abilities, but you don't like their attitude, either shop around till you get what you want all in one package, or you can do what Sharon did. Learn to be assertive so you can get him or her off the pedestal and teach them to accept you in becoming an equal partner in your care. Remember, it's not their vote, it's yours.